Hello, everyone, and thank you for joining us today for the virtual meeting of the Consumer Consortium on eHealth. This is Kate Berry, CEO of the National eHealth Collaborative, or NEHIC. We have a great program today. Can you go to the next slide, please? I'd like to just provide a quick overview of the agenda and then get us kicked off into the substance. First of all, we're going to have an overview of kind of the background of the National eHealth Collaborative Consumer Consortium and the 2012 plan, an update on the progress to date of that plan, and then an introduction to a framework for patient engagement that's been under development for some time, as well as an orientation to how we're going to seek feedback on that framework. So we'll talk about how to provide your input into the framework as it evolves. And then we're going to have a presentation on mobilizing consumers and providers to drive value in healthcare. And finally, we'll have some time for Q&A and feedback, and we will pause after each portion of the major agenda items to get your feedback. And you can interact in a couple of ways on this program. We'll have time, if you'd like to raise your hand on the right-hand panel of the webinar screen, we can unmute your line and you can just talk and give us, share your question and we'll respond to that. And then another option is to, excuse me, to type your question into the Q&A window also on the right-hand side of the panel. So please, think about your questions as we go along. Next slide, please. So just quick background, quick overview. The Consumer Consortium on eHealth is a very inclusive group of all healthcare stakeholders who are interested in coming together to coordinate and collaborate around how to with health IT tools. This is such a new area and I think such a great opportunity that we found that many together, and we're really just trying to create a forum for sharing best practices, working on initiatives together, identifying tools and resources that can make a difference, and so we're really excited to have a high level of engagement in this effort, and we've got more than 200 organizations that have been participating since we've gotten this program launched. Next slide, please. This just gives you, we did also put in place, even before we officially launched the Consumer Consortium, we created a steering committee of key leaders to engage in the development of the strategy and to help set the agenda and to provide, to really set the goals and objectives for this group. So we've got a great group of leaders, as you can see on this slide, participating on the Consortium Steering Committee. Next slide, please. And just to reiterate real quickly, so the goals, again, are to bring together those who are interested in working on consumer engagement, convene those diverse stakeholders, share the best practices, try to come up with a program for effective consumer engagement that we can all leverage with our various different constituencies, and really work to engage and empower consumers on all these different tools that are available. And this is an area of so much innovation and so much fast movement that, again, we're going to try to evolve the consortium's work as the market evolves. Next slide, please. And at this point, I'd like to turn the presentation over to my colleague, Jenna Brample, who has been leading the of NEHIC and is engaging with many of you on the various tracks that we're working on based on the 2012 plan. So, Jenna.
Great. Thank you so much, Kate. And thank you all for joining us for this virtual meeting today. I just wanted to give you all a brief update in terms of the work that's been going on trying to reach our goals that we set for ourselves at the beginning of the year with the 2012 action plan. For those of you who were able to join us for our last virtual meeting when we did go through the action plan, I'm just going to give a quick overview of the two tracks that we're focusing on with that. If you have not seen the action plan, it is available on our website. All you have to do is go to nationalehealth.org/consumers, and you'll be able to view that plan. And it has been updated, so it should reflect the work that's been done to date. So essentially with the first track of the 2012 action plan, we are doing message development. We're trying to create sets of messages that are targeted to specific audiences that have been identified by the members of the consortium. So during our last December 19th virtual meeting, the attendees on that meeting gave us some suggestions for the different groups that we should target. I've been working with consortium volunteers to start working on some of these message sets, and thus far we have finalized message sets for the age group 50 to 65. Those are available on our website at nationalehealth.org/materials-consumer-consortium-members. So it's that link at the bottom of this slide. And I worked really closely with one of the volunteers, so I just want to thank Patricia Joseph for being really, really helpful and pretty instrumental in developing that message set. And what we're trying to do with those is to just give you a starting point for developing messages for targeted audiences. We encourage within your organizations and tailor them to the best of your ability so that it suits the audience that you're trying to reach. And from there, we are now working on messages for working mothers. We're working with SAMHSA to develop messages for behavioral health and substance abuse audiences. And I've also been working with one of our other consortium volunteers, Marianne Sterling, on developing caregivers messaging. And from there, we have other volunteers who have come forward. So very shortly, I'm going to begin working with them on messages for diabetes patients and messages for healthy young adults. So I really encourage all of you, if you are interested in developing any of these messages or providing feedback, to please get in touch with me. My contact information is available in the last newsletter of the consortium. I'm jbramble@nationalehealth.org. So just quickly, the message development process starts with volunteers coming forward. We develop a draft. The draft messages are then sent around to the consortium steering committee for first-round vetting. And then following that and the input of some other volunteers, we then go to the full consortium for vetting. And for those of you who have been receiving the consortium newsletters, you'll notice that the last one had the vetting process in it. So we usually just do a quick survey and take feedback that way. You can also email me and give feedback in that way as well. And then from there, we're going to begin developing different materials. As much as we encourage you to use the messages as is, I am going to start working with some more consortium volunteers to create some materials, fact sheets, different things that you can use to start putting those messages in action and really utilizing them to the best of your ability. So these, I'll give you some sample materials, and they will also go on the website at that link below. So I will make sure that you all know when those are available for download. And just a quick note, tomorrow is World Health Day, for those of you who did not know. And the theme this year of World Health Day is Aging and Health. So I think it's probably a really good time to start using the messages that we've already made available and try to start testing those with your audiences to see how they work. All right. So the next track that we are looking at is best practices and framework development. And here we took this directly from the Consumer Consortium member survey that we did last year, just trying to get a sense of what the members, what all of you wanted to get out of this initiative. So a lot of you identified that you wanted us to help put forward and recognize some best practices of where consumer engagement is really successful and where it's really happening on a large scale. So we have identified, you can see on the right of the slide here, we have identified some areas of best practice where consumer engagement is really happening and it's really successful. And as a part of that effort, NEHIC, through our NEHIC University program, has launched what's called the Spotlight on Consumer Engagement program. And if you go to that link, you can click on that link, and the slides are available on our website, so you can click on the link from there as well. You'll see the different programs that we are offering and those that we have already offered. Our first program in that series was looking at the power of personal connected healthcare, and we featured the Continua Alliance and the Dossier Consortium. Our next program in that series is going to be on April 23rd. we're identifying Century Health and Aetna, which they're instituting a new program using an individual health record, which allows for better patient-physician communication, gives the patients a more robust record to look at, which includes all their payment information as well as their clinical health information. It's just a really innovative way to think about an EHR. So we're featuring them on April 23rd. And then on April 24th, we're going to be doing a program updating you on the Open Notes project, which is run by Tom Del Banco out of Harvard. And that is a project that is essentially having doctors share their notes with their patients. And we're going to take a look at how that's coming along. We're also going to feature Dr. Danny Sands and our very own e-patient Dave to give us an update on the work that project has been doing. So we are always looking for best practices. If you have any, we do have a submission portal on the NEHIC website at the link at the top of that slide. So if there are any areas of best practice that you would like us to feature or that we should look into and do some more recognition of, please do submit those. We are always asking for some more recommendations. And with that, we are also looking at developing a framework for how an engaged health system will look and sort of how health systems and different practices can start to engage their patients. Leslie Kelly Hall is going to give you an update on that in just a minute, so I'm not going to spend a lot of time on it. But we will make it available on the website, and I will show you later how you can go into the NEHIC online community and give feedback on that. And just another progress update, we are still working very closely with the Office of the National Coordinator for Health IT with their consumer engagement efforts. As a lot of you know, the Consumer Consortium, NEHIC, on behalf of the Consumer Consortium, took a pledge for non-data holders as part of the ONC Pledge Program. We pledged to educate and reach out to consumers to help engage them with Health IT. We are also partnering with them to spread the word about the ONC Video Challenge. A lot of you probably saw the Healthy New Year Challenge that they issued at the beginning of 2012, and they have selected the winner. So you should go to the healthynewyear.challenge.gov link and check out the winning videos. There are actually some really creative and interesting ones on there. They recently also launched the Beat Down Blood Pressure Challenge. So here's the our website. If you look at the chat window on the right panel of this webinar, the link is in there, so just click on that and you'll be able to download these slides. For more information on how you can partner with ONC on these video challenges, go to bloodpressure.challenge.gov. All right, so with that, I am going to stop and move over to Kate and see if there are any questions or if there's any feedback. No questions?
I don't see any questions at this time, Jenna. But so again, folks, please do feel free to either raise your hand or let us know, or type in a question in the chat. But so at this point, I would like to introduce, I'm really happy to introduce Leslie Kelly Hall. I'm sure you all know her. Leslie is Senior Vice President for Policy at HealthWise, and we're very happy to also have Leslie on our steering committee for the Consumer Consortium, as well as serving as a consumer representative on the National eHealth Collaborative Board. So Leslie's a good friend. She's been leading this effort to develop the framework. And so with that, I will ask Leslie to walk us through the patient framework.
Great. Thanks, Kate. You know, we often talk about patient engagement in the business, and we wonder what it is. One of the best descriptions I've heard of what it isn't is e-patient Dave describing that a patient in healthcare today is like a car going through the car wash. The car just runs on through and things happen to it. Well, that's not really how any of us would like to behave or be treated as a patient or involved in the healthcare system. So we hope to address that a bit. Next slide. So patient engagement is like art. You need a common definition, right? Otherwise, we don't know it when we see it. And we'd like to advance the industry all of the people involved in this consortium, we want to make sure that patients are engaged, that they're part of their health care, that they're actually not passive, but participatory. Next click. And you can see, until we have a common definition, art changes. Next slide. So NEHIC has convened, and this is our first group to meet, and we really want to define a framework for health information technology that's based on the industry and the market, that recognizes that it will evolve, and also provides opportunity for recognition. Wouldn't we love to have a health system recognized as the most engaging health system to patients and consumers? Wouldn't that be a switch for how healthcare is today? Next slide. So far, we've taken this framework to about 80 individuals representing 10 organizations, patient groups. It's very high level. We do know that it will evolve. We also recognize, there's no right answer. There's only answers we all can agree on and promote. Next slide. So the patient engagement framework for health information technology we consider has 4 phases. Inform me, engage me, empower me, and partner with me. We'll talk about each one. Next, please. So we will be commenting on a document online, and Jen is going to take us through that at the end of the presentation, how each of us can go and make updates and changes. This is how the high-level framework looks today. Next slide. Along with that is a glossary of terms that actually provides definitions. So we encourage you to not only provide feedback to the document, but also the glossary itself. And if you have additions and terms, please make sure there's definitions associated with that. Next slide. So what is Inform Me? Well, Inform Me is, I think, what most of us are used to on the web. It's information about the provider or the services or the education. It's generally a website and is often marketing focused. So if we think about a provider in this case, I'm going to use that term quite broadly. That could be a provider in a hospital or disease management or population health management. So let's think about the broader term of provider and think about health information technology as a whole. But Inform Me is those early days of websites. It's really about attracting me, getting me in and learning more about the institution or the provider. Next slide. Key characteristics of this. This is really an emerging EHR or PHR site. Maybe the hospital is still trying to figure out what their long-term strategy might be with regard to technology. But there is some information self-service on the web. There are forms to print and some electronic tools and things about convenience and wayfinding. Next slide. So the document today talks about these levels of e-tools or information online. Things that are around education or convenience, information about convenience. This also might include marketing material, forms to print, and e-tools. So very much of a marketing focus. Next slide. The next level of engagement is really an interactive administrative focus. It's that next phase that in any industry we see, which is how do I transact with that organization? This might be forms and bill pay, regulatory forms. It's all about making it easier to do business with the provider or the payer. So the principal driver of Engage Me, in this case, is transact with me. Let's do business together easier. Next slide. So Engage Me is everything that we saw before in Inform Me, plus this site would probably have an EHR and PHR systems that are meaningful use 1 certified. Patients can view their records. The patient can also generate data today. We might have administrative tools and new forms that are interactive and online. Next slide. So Engage Me, again, it's everything from Inform Me, plus things around meaningful use. It's access to records. It might be patient reminders, patient-generated data like experience of care surveys, or system assessments, or self-management diaries and tools. Administrative things like creating my patient profile, or registering online, paying a bill, register for a class, email customer service at my health system, or schedule an appointment. Things like pregnancy tracking, fitness tracking, any sort of tracking and support systems, and also social media that doesn't include personal health information. And then forms online, things like request my record and so forth. Next slide. Empower Me. Empower Me is really emerging information sharing. It's episodic and generally institutionally focused. It assumes a relationship with that health system and a patient. And the principal driver around this is retain me. Keep me as a patient. Keep me as an active consumer with this organization. Next slide. So Empower Me is Inform Me and Engage Me, and make this institution is an EHR and PHR that's Meaningful Use 2 certified. Patients are viewing, downloading, and transmitting records. There's some aspect of e-care involved. And records are starting to be integrated with within the health system and within the organizations that are connected to that health system. So this might look, again, like Inform Me plus Engage Me plus now things like the Meaningful Use 2 certified, download my records, transmit, quality and safety reports that might be totally patient-centered. Instead of the idea of looking and saying, how does my hospital do, this might be, how do I do compared to all the people in the population that I'm in. Integrated records, a summary of care, referral coordination, multiple clinician records, things like video and photography integrated into the record. We begin to see a more holistic approach to records, and e-visits are active. It might be care management or virtual coaching or nurses online or secure messaging. We also begin to see the forms are more interactive and assume much more of a patient's role. Next slide. And then we think the really powerful, engaging health systems are all about partnership. Partnership in care. Partner with me. So the health IT facilitates a very holistic record with many participants in care, including the patient and their supporting family members and others that are sharing in care plans and decisions. It's really about team-based care that this HIT facilitates and promotes. Next slide. This again is building upon Inform, Engage, and Empower Me. And this will probably be Meaningful Use 3 as that gets defined in the future. And we'll look for things that really support the team in care, making sure that all members' voices are included, including the patient, that there are analytics and quality measures that serve the patient, and that the record is more extra-graded. It's really looking about not just a health system, but all the organizations that contribute and all the individuals that contribute to that care of the patient. Next slide. So things like shared decision-making, or medications, or tests, or surgical decisions, interactive tools online, how do I plan my care, my wellness plan, my advanced care planning, coordination of care. The systems would be integrated with public health, much more holistic, probably connected to an HIE. And then also things to help the team in transitions of care and coordination, home telemetry, condition self-management, and now integration with social media in a way that is protected and private, but integrates PHI. The analytics and the quality are all around the patient. So we might have patient-specific predictive modeling, things that really pinpoint to a patient where their care is going and what interventions they can take to improve their health as a co-producer of their health. Patient-specific care coordination And the idea of patient accountability. How am I doing? Next slide. So the patient engagement framework, there are some next steps. And Jenna's going to go into details, but we will ask for feedback. We'll look at feedback on the framework and the glossary. We'll revise it, and then we'll continue to publish and provide a final version. Next slide. Jenna, do you want to talk about this now?
No, you can finish up. I'll just go through this quickly. So
okay.
There we
so
go.
Next slide. So this is a picture of a patient that is here in Idaho. Her name is Peggy Jo, and I would encourage all of you to go to this link. She's a woman that reminds me on a daily basis of why all of us are in this business. And she is a woman who has brain bleeds very often, and she has an undiagnosed disease. And she has been in medical comas and been on chemotherapy. She is really, it's a mystery about what is the matter with Peggy Jo. But what she does know is that her voice is unique, and she has material information to add to her care, as all of us do as patients. We want to be heard. Our voices need to be heard. And what we hope to do with this patient industry, awareness, knowledge, communication tool that helps to get that patient voice heard in every part of care. So please go to that site, and I will turn this over to Jenna, and I think then we'll go into questions.
Thanks, Leslie. So really quick, as you saw on the previous slide, there are two ways that you can give feedback on the framework, and I'm going to show you one of the ways through the NEHIC website. And for those of you who have been to our website before, you know that we have this section called Collaborate. So what you're going to do if you'd like to give feedback on the framework through our online community, you'll come onto our website, and up here where it currently says Log Out, it'll be a Register Login button. So you're going to create yourself an online profile, and it'll look kind of like this, where it'll have your username, and you can put in a picture. From there, you'll click on the Collaborate button, and it will take you into the Collaborate section. And these are the featured items on the front of the page. And as you can see, one of the most recent items was posting of the wiki for the patient engagement framework. So from there, once you log in, you're going to go to Community up here in the right-hand corner, and you'll click on Groups. And once you click on Groups, you're going to find the Consumer Consortium on eHealth group. And that's the one that we have everything posted in. So once you click on that group, it'll give you the option to join. And once you're in, you'll go to the top with these little tabs up here. And you'll click on Wikis. And we have the framework in a wiki format so that everyone can comment on it and edit it sort of like you would with Wikipedia, for example. So once you're in the wikis, you click on whether you want to edit the engagement, the framework, the glossary of terms, or the framework itself. So I'll click on glossary of terms just so you can get a sense of what that looks like. And so this is what it looks like currently. But once you are in and you want to make your edit, you'll go to this little Edit tab up here, and it will take you to a place where you can just add your comments. Adding your comments, I encourage you to put your name next to the comments so that we know who is making them. If you have questions, you can add those in, and it'll show up in the new wiki format. So, for example, if I wanted to add my edits here, I would then go down to the bottom, and I will click Save. And then once you go back, you can see my edits right here. So you'll be able to edit it in real time, and then we can come in and see who's editing what or what suggestions. And then once that happens, we'll go back and modify everything and come up with a more final version. So that's the same for the glossary of terms, and it's the same for the actual framework itself, so you can make edits directly to that as well. So another thing that we are going to do is send out an email with the framework in it, so you can also have the option to just track changes on that, and I'll send you an email that you can reply to. You can either send it back to me or you can send it to Leslie directly, and we'll also incorporate those changes as well. So from there, let's throw it back over to Kate so that she can address any questions or comments that people have.
Thank you so much, Leslie and Jenna. And we do have a couple of questions that have come in. So Leslie, maybe you can take these. So one is, what is the future of patient portals as a tool for engaging consumers and patients? What are the barriers for broad adoption? And are there plans for further education in the use of portals? Can you talk to that one?
Sure. Thank you, Kate. You know, patient portals are evolving. And I think that what we see is that patients should be able to identify what is their preference of communication. Each of us has preferences in a variety of industries that we do online services with. For some, it might be a portal. For some, it might be their Android or their iPad or their desktop. So we need, as an industry, to acknowledge that patients will have the same kinds of preferences as all of us do as consumers in other industries. That said, the portal will still be around. I might want my information transmitted to my portal at one spot. I also might want to have my provider be my central spot. I think this will be evolving, as we've seen in every other industry. The important thing to note is that the patient, as new and emerging consumers and engaged patients, really will have preferences that should be considered as each one of us in providing the technology consider when we design our systems and provide those to patients.
It does seem also to me like stage 2 of meaningful use will encourage more portals and the use of portals as a way for patients to access their information electronically as well, right?
They will, and also what's exciting about meaningful use too is the concept of using health information service providers' direct component that allows information to be transmitted to these compliant systems. So it would appear like an email that I could go to and review. So we're seeing emerging technologies and very forward-thinking in ONC and in standards development to make sure those kinds of preferences will be available to patients.
Excellent. So we have another question, Leslie. So at what level in the framework, Engage or Empower, would patient privacy consent capture be offered?
That's a great question. We believe that patient privacy and consent has to be assumed throughout. As soon as you start sharing PHI, then the burden of security and privacy needs to be in place. You know, I had some great advice from David McCauley from Cerner, and he put it this way, that information should be patient-directed and provider-protected. And so the burden of privacy and security is on the covered entity, but the definition and direction of use can be on the patient. We are, after all adults and have the ability to use our information in ways that are appropriate for our own use.
So, Leslie, another one, a very interesting question. So how would a patient effectively apply this framework, given that they may have multiple providers and multiple insurance coverages? You know, how does the patient potentially apply this framework?
Well, I believe that first, having a framework that the industry can agree on is an important part of that. Just as today I make a decision of where I might buy my coffee because they'll take my ATM card, I will make decisions on where I might have my services provided based upon who interacts with me in a way that I prefer. So I think the framework will be important in a definitional sense. and hopefully in a directional sense that allows organizations who are thinking about patient engagement move to more forward-thinking systems. But one would hope, as the patient is looking at options, that they would look and see which health system provides them, and payers and plans provides them with things that are the most interoperable and the most convenient for them.
We're getting some really great, thoughtful questions as well. So another one, Leslie. So, what examples can you think of any ACOs or patient-centered medical homes that are actively engaging, the large proportion of their patients? Kaiser was an example given here, but what examples are you aware of, and to what extent are they able to show improvements in quality and reductions in cost?
We're seeing a really variety of organizations involved, and in some taking an approach in the plan levels are coming out with very advanced population health management tools and engaging patients while they're still in the hospital. I've talked to some organizations out of Humana, and they were doing some advanced work, doing management and interaction and engagement with patients before they were discharged from the hospital to make sure that their care was managed through a combination of online services and nurse call support. So I think there's a huge variety of innovation. Of course, you mentioned Kaiser, Bayland Health. Group Health provides great tools online, as well as a very aggressive patient management through their MyChart application. But I do think that this is emerging. Dacia, who I think you're highlighting at another date, is also working in engagement with employer-based and in more community health approaches. So this is still quite a new and emerging field. Having a common construct and common definitions, I think, will help us all to promote it and progress.
We're continuing to gather best practices because this is new and it's evolving quickly. So another one for you, Leslie. So the stages 3 and 4, Empower Me and Partner with Me, may depend in part on putting in place some incentives or reimbursement mechanisms, for example, for e-visits. Can you say a few words about key barriers or leverage points related to reimbursement for advancing this patient framework?
I'm not an expert in reimbursement, but I have something that actually a CEO of a hospital once said to me, said that doing the right thing is often both financially and clinically rewarding. And I think that as reimbursement comes into place, we do see that there are incentives and maybe accelerate things quickly. But an example here in Idaho is Primary Health System, which is a for-profit multi-specialty clinic. And they decided to behave as if they were an ACO or a patient-centered medical home about 2 years ago. And they determined that if they aggressively managed patients, interacted with them, provided them tools, that they could actually manage their health better and make more money. What they found is that perhaps that additional visit of $45 to $90 for that patient and that ongoing activity of managing the patient helped the patient have a higher degree of satisfaction, the physician a higher degree of satisfaction, and reduced emergency room visits. So I think that oftentimes when something isn't prevalent, we find ways to make it not relevant. And the reimbursement argument, although quite compelling, is one largely around the unknown. We don't yet know what a fully engaged health system with a patient will look like. And I'm excited about that opportunity.
So Leslie, we now have a comment and a question. The framework is very interesting as a description in it. Potentially to a call to action for providers and or patients.
I think that's great. We see some parallel efforts going on, and I'd like to congratulate both NEHIC and the ONC for starting to really look at how to time messaging to patients, a variety of different populations. So I think there's a messaging effort that's going on. There's the meaningful use effort that's going on that's compelling all of us to move to electronic health records and health information technology. We would love to see that as each of us works in health information technology, that we begin to think that everything that happens in an EHR has a corresponding or compatible reaction inside a patient-facing system. So we begin to see how that patient should begin to interact online. It's really that other side of the coin. And as we think about providing those services, it'll challenge us in new ways.
I think that I'm going to just run through a couple more questions before we go to the next phase, and then we can come back to these questions a little bit later. But one or two more, Leslie. So what are your thoughts on how something like Blue Button, that the VA and DoD and others are using, well, where is that in relation to commercial providers? Are you aware of that?
Yes, the Blue Button project, first and foremost, was a brilliant coalescing and call to action message that really challenged vendors and providers to provide a way to get easy access for information to the patient. It's been widely used in the VA, and there are challenges associated with it as we try to finalize and finesse the standards for interoperability. But it's a great tool to begin to see how do we get those records downloaded. And I think it was a catalyzing event. In standards, as we move to things like the consolidated CDA and the direct framework, I think we'll see even better and more discrete data being able to be viewed or downloaded or transmitted by any patient.
So I just want to read this comment as well for everyone. So, there's a comment, we're glad to see that the framework makes reference to the meaningful use stages, because meaningful use will likely be a key driver for getting patients more engaged. So can you elaborate at all on what has been considered regarding aligning the framework with meaningful use?
Yes, actually, I didn't mention early on, I'm on the standards committee for meaningful use, and also very much involved in those activities myself, as are others that have helped provide insight to the framework. If I could wave my magic wand, I would hope that Meaningful Use 3 was all about the patient and making sure that collaborative care starts to form as a result of these great incentives and great standards coming out of meaningful use. So we see that there's great opportunity to align and harmonize those efforts. Even in meaningful use 2, we see standards that are being formed for the clinical summary document being used in many different use cases, including those for the patient. And we think that that will continue, that this harmonization of effort in those policy and standards can help to drive interoperability between patients, their providers, and their caregivers.
So Leslie, thank you so much. I think this was a great discussion on the framework, and I think we got some really good comments and questions that will help us make this even better. At this point, I want to transition to our next presenter. I'm very happy to introduce Rose Maljanian. Rose has 25 years of experience in the healthcare industry, including managed care, specialty population health management, delivery systems, public health settings, as well as product strategy design and development, mergers and acquisitions, operations and fiscal management, quality improvement, and outcomes research. So Rose founded and leads a company called Health Cause, which is a private company focused on improving health while making healthcare more affordable by aligning accountability models and supports for success. So prior to this role, Rose was Senior Vice President of Product Innovation at Magellan Health Services, as well as Vice President for Clinical Interventions at Humana. So Rose is serving as a featured speaker for NEHIC today and also as part of our NEHIC University series on consumer engagement. So Rose, you're up next.
Thanks so much, Kate, for having me here. I'm delighted to address this important and growing community that you've organized here at NEHIC. As Kate mentioned, I'm the CEO of a new company called Health Cause. The cause is an acronym for Combining Accountability with Support, which in my view is mobilization to action, is what consumer engagement is all about. The first slide, and I'm seeing, Jenna, did you turn over the controls to me here?
I did.
Oh, we're not advancing.
Okay, let me try it. All right, we're good.
Okay, great. So since consumer engagement has become such a buzz term in the industry, let's start with a few basics, such as why we're all here talking about consumer engagement and why it's so important for all stakeholders. First off, consumers are the end user for all clients. Ultimately, consumer behaviors and actions significantly contribute to health and cost outcomes. Documentation of outcomes and therefore value to clients is dependent on consumers contributing data. We can't just rely on claims data alone. For most of us on this call, our focus is health and quality improvement, but there also is a practical business reason for focusing on consumer engagement. Because they are all end users of our products and services, a positive consumer experience today is required to achieve and maintain financial success tomorrow. Next slide. What are we engaging consumers in? Had a funny conversation with a group a couple of months back as I was introducing healthcare, and they said to me, as I talked about the health cause model, they said, well, we're not doing that at all. We're focused on consumer engagement. I said to them, okay, so what are you engaging consumers in? Dead silence. They had no idea, but they were all running around doing consumer engagement. So I have a little hint today in this slide, that bottom box on the right. We are, the simple answer, engaging their health, their care processes by being active participants, and making healthcare more affordable for them and the system, aka value. So for me, it's not only about meaningful use, it's about meaningful impact and these outcomes. And we're doing this in a framework where we're aligning financial incentives and quality gating a system for providers and a total population approach with tailored interventions that span the full continuum of care. Next slide. Moving from the why and the what to the how is the real question if we're going to create transformational change. As I built Health Cause, I drew from a number of social marketing principles that I think can inform all of our work. So I'll go through a few of these examples. So intrinsic motivation. We want to help consumers be autonomous, to be a master of their own conditions, an expert on themselves and their health issues, and to order for them to get them to take action to have purpose. And purpose not only for their individual goals, but the collective goals we're trying to accomplish with the healthcare system. In terms of extrinsic motivation, we want to be able to give people choice, but we want to give them options in a way that increases the likelihood that they will choose the right thing for themselves and the system. The concept of managed consumerism is a really interesting one because it blends the demand side, understanding that more care is not always better care, and the supply side that includes maintenance of the healthy competition in the marketplace. When we think about building things for consumers that are really meant to last, when I talk about stickiness principles, this comes from the work of Heath and Heath, and it's about keeping the concepts simple, making it concrete, and that's where within that health cause acronym, it's, here are our accountabilities, and then here are the supports that we're providing to you so that you can be successful. And the notion of emotions and making it real for them in real life stories is so important. With healthcare reform, not a single day goes by that it's not on the news. So most consumers know that the high cost of healthcare affects them very deeply on a regular basis. It has flattened wages, affected availability of jobs, and thus their overall quality of life. So real improvements in healthcare system can impact them significantly. Today, unlike 10 years ago when the pioneers of care management began, we have the luxury of technology, and that's a really powerful thing. With technology, we are now able to we have access to social media and digitization of not only the human genome, but the diagnostics and other aspects of care that allow us to transport messages, data, care, and these diagnostics in a way we never thought possible. Next slide. So let's talk about the current model for delivering these consumer engagement solutions. To get to consumers today, there are many layers for us to penetrate. Consumers interact in their community and in their workplace on a daily basis. They interact with a delivery system, mainly in a reactive way, and they have small and often distant connect to their health plan focused on transaction around claims. This leads to lack of empowerment and accountability due to confusing messages and options coming from all different directions. Next slide. Where we need to go is a new model where consumers are at the center and other stakeholders come together in a coordinated support community. Whether these are led by payers or emerging delivery system models, we need to have clear lines of accountability for cost and quality, and that ultimately is what will differentiate these new initiatives from older demonstration projects where stakeholders are brought together in alliances, but there's confusion around roles and responsibilities. Next slide. Engagement solutions. I'm going to spend some time on this slide because I think there's some examples in here that are going to be really informative for the group and will bring to light some of the things where we have not done such a great job with engagement and how that represents such a missed opportunity. Now with some of the lessons learned, fortunately, we've begun to be more consumer-focused in our approaches. I'm going to share these examples based on some of my own personal experience with building programs, review of others' programs as part of investment teams, and then some things from the literature. If we look at the first example on how we define the population or what we focus on, in the past we've had these distinct initiatives either focused on a small sliver of high-risk individuals or on a wellness population only. If you focus on the high risk only, you're not preventing people from getting into the high risk bucket going forward. If you focus on wellness alone, you're missing the opportunity for real costs that are hitting the system today and real people that are struggling with quality issues. So the new promise for this is an integrated continuum with multiple solutions to meet people where they are. We've also in the past suffered from lack of customization to special needs populations. I'm seeing more customization of interventions for senior populations. Seniors, despite what people believe, do use technologies. And we're seeing this in online dating services are the hottest thing for seniors. And we're also seeing seniors who don't live closely to their relatives taking advantage of technologies like Skype so they can interact with their children and grandchildren. So we should not count them out in use of technology. With the exchanges, we're going to see new populations moving into those buckets, and we can't assume that they're all like the Medicaid population of today. So I'm seeing groups really thinking about subsets that may be hitting those exchanges that look very different, some of them mirroring the commercial population versus a straight-up Medicaid solution. On an intervention strategies, a huge mistake of the past were these high-cost scripted calls. One, because of the high cost, you're stuck with only addressing a small subset of the population. And two, with the scripted, you're just not hitting the need of a population. So the use of technology really enables us to extend the reach in a more cost-efficient way. On that topic of scripted calls, I'm going to give you an example that was kind of a sad one that I witnessed as I was doing these due diligence rounds on a company on behalf of an investor. And I'm listening into this call between a coach and a patient that she just got on the phone. The patient was a cancer patient who had undergone a number of surgeries and chemotherapy. And when the coach said hello, right away the patient said, you know, can I talk at a different time? My home health aide is here with me. I only have her 2 hours a week, and I have so much help that I need. And the coach pressed on and said, this will only take a little bit of your time. I need to get this assessment done with you. So she proceeds to ask the patient a number of questions, and time is going on. And the patient again pleads, you know, I only have this home health aide for a little bit of time. And she said, oh, don't worry, I'm almost done, just a few more questions. Finishes up the call. It was about 25 minutes. And the coach hangs up feeling very satisfied that she got this assessment done and checked off a task on her list. But this poor patient is not only did it not meet any of her needs, but it actually robbed her of important time that she really needed with her home health aide. So that's an example of how we really need to think about what the consumer needs if we want to keep them engaged in a program versus getting our work done. The other thing in coaching models is a pitfall of taking a singular approach to coaching. And, you know, we get these kind of flash-in-the-pan approaches, or we get a good body of research that supports one technique and assumes it applies to all patients. So readiness to change, motivational interviewing, very, very good techniques. But we need to use them in flexible models with skilled teams. And Magellan was an organization that did this particularly well because they understood that if someone was stuck in a negative thought pattern, I'm a failure, I've tried to lose weight so many times, I just can't do it, I don't want to talk about it, I'm never going to do it. This person's stuck in a negative thought pattern, so you need to use a different technique, a cognitive behavioral therapy technique, to get them out of that negative thought pattern before you start your motivational interviewing and move them along that change. So you really need highly adaptive teams that have the skills focused on the individual person. The overlays and duplications, we've come a long way here. We used to have 3 or 4 different coaches making calls, people in separate programs for diabetes and cardiac disease and smoking cessation. And many organizations have learned that patients don't want 10 different calls from 5 different people, and have now created more comprehensive programs, even where they have vendors in play coming up with workflows to avoid that duplication and overlay. This next topic on intervention strategies is a real hot button for me. This, disjointed, flashy approaches appealing to small audiences and this whole gamification piece. We need to think about gamification as one tool amongst many that may appeal to a subset of the population. And we need to have these things set in a comprehensive strategy that has real staying power to keep the person engaged. And I'm going to give you an example of an app that I just tested. It was an award-winning app, so that was a good thing. Downloadable at no charge, also really great. It focused on actions, which also really great. Love that actionable approach. So I start into it. Pretty quick registration process, pretty quick little survey to get me going, and then my first set of actions get served up to me. Under the fitness category, it asked me if I would commit to 20 minutes of swimming. I don't swim or have a pool close by to me, and I live in New England, so it's a short outdoor season. So that was a no. I couldn't commit to that. Then it asked me if I would commit to 20 minutes of playing tennis. Again, I said no. Then it asked me if I'd commit to 20 minutes of weightlifting. I said no. Now, as it is, I do exercise daily, but I use a video training series of a blend of cardio and strength. So it happened to be that the activities they served up to me were not of interest. Not that I wasn't an exerciser, but it kicked me out of the fitness category. I guess it gave up after those 3 attempts. Then the next action it served up was I willing to commit to regularly washing my hands? Now, knowing my history, many of you don't, but I was originally trained in surgical critical care nursing, so you can imagine I'm a pretty obsessive hand washer, so not a topic I needed prodding on. And then there were some other actions like consumption of vegetables, which I already also was doing. So then all 3 of these examples made me concerned about, well, how would they actually track outcomes on this? They may wrongly categorize me as resistant to exercising, and they may also state that they created behavior change in hand washing and vegetable intake. All 3 of those assumptions are not accurate. And worst of all, for me as a consumer, I thought the app was completely useless, so it proved to be a wasted opportunity in engagement for me. Long and short on the gamification, just watch what you're investing in and make sure they're relevant. In the category of data and communication, another really important piece here, and I'm glad there was a question on patient portals because we have to be really, really careful here. We don't want generic portals. We know from some of the large players in the PHRs that they had to pull out and rethink this whole thing. There's lots of studies that show people don't want to read endless information about themselves. And if we are presenting data to them, we need to make sure that that data is actionable. So I have to give you an example of a PHR and PBM tool that I just tested. And they have full access to my claims data, so that certainly is not the issue. I log on. Among the first alerts in the PHR that served up to me is to read about head injuries. Couldn't imagine why I was getting an alert to read up about head injuries. And then after I dived deeper into the claims history, I noted that, oh yes, my husband had an x-ray of his cheek due to a one-time mishap 3 years earlier helping out as an assistant coach on the ball field. Interesting, but not relevant to me today. Then I went in to use my PBM tool. and found an alert stating I could be saving money on my prescription. While I knew I hadn't had many prescriptions and certainly no high-cost brand drugs, I continued on. After about 20 minutes of watching the spinning wheel on my computer screen while their very large, robust database was churning for my individual information, and intermittently during that process I had to enter in some data that should have been in the system overall, my individualized report came back stating for my one-time inhaler I paid $19. I could have paid only $19, and therefore I could have saved $0. You could imagine how frustrated I was after this output going through all of that. So how many times do you think I went back in to use that same tool? Same number, 0. So let's keep a few things in mind when we're going to invest in the next whiz-bang technology to engage consumers. We need to remember ease of use and relevancy and value to the end user. Next slide. So how do we pull all of this together to support consumers? Think about engagement as a continuum of mobilization to action strategies. I'm sharing with you here an example of how I've structured this in the Health Cause Accountability and Support platform. Assessment. Start with an understanding of your population and the individual. Awareness. Prime the pump with messages so they know the purpose of your combined initiative. So take an example of medication adherence. Don't just start sending someone alerts about pharmacy refills. They need to understand the context of medication adherence and what that means in terms of potential complications for themselves, how they're not alone and others are experiencing those same issues, and it's okay to talk with your doctor about those things, and then give them the individualized alert. So that messaging is so important up front. Aligned incentives. Tie actions to rewards, and those can be monetary and non-monetary, and provide feedback on their progress. Action-oriented portals. Make the actions and recording of actions easy. And this is the future of portals in my mind. We cannot just serve up information to people. We have to digest it for them, and we have to make it actionable and tie it to key quality and cost drivers that are relevant to their personal situation. Accomplishment reporting, important on two fronts. Real-time feedback to the consumers, and easy access to data for providers. Providers will love you if they can get real-time access to data on their patients, especially self-reported data that is not easy for them to get a hold of. They are tired of participating in registry activities where they get quarterly reports of aggregated data provided in a way that has a lag time that is meaningless to their patients. Two, from a program level, the continuous quality improvement, access to this data on an aggregate basis for the program managers to continually learn from that data and improve the program. So by approaching engagement as a continuum, we're creating this loop of engagement activities and learning so we can continually improve impact and create that meaningful impact. Next slide. I'd like to close with an inspirational quote from someone I consider an inspirational leader, Mike McAllister, who served Humana as a CEO and has been there 40 years. His quote was this, and very intriguing because he was presenting at an investor meeting, and this was a big focus for him. if we arm people with actionable information, they will do the right thing on their behalf almost always. I thought that was very profound. And then Judy Hibbard of University of Oregon just published a study in Health Affairs supporting this very notion. It showed, and this was in a randomized control study, that 90% will take the right action, that is, select high-value care when it is appropriately framed and interpreted. So believe in the power of people and put your energy into creating a framework of aligned accountabilities and incentives and get actionable information support tools into the hands of consumers. Thanks very much, everyone.
Thank you, Rose. That was a fantastic presentation. Really appreciate it. And it does feel like there's synergy between your remarks about what it takes to achieve that accountability and support with the framework that Leslie presented. So I believe we have someone with their hand up. So Matt or Jenna, can you unmute if Michael Crampton still has his hand up and is waiting to ask a question? Can we?
He's unmuted.
So Michael, did you want to ask a question or make a comment?
Is Michael on mute? He might be on mute on his end.
So Michael Crampton, if you still have a question, I wanted to give you a chance to ask it, but while we figure this out, I'm going to move on to another question, and we'll give him another second here. Oh, here, I guess he wrote his question in. So have you considered positioning the patient's PHR as her medical data repository and education information services and communications platform to enable her to engage with her medical providers as a peer, share medical information, and communicate directly? So, Rose, maybe you can start, and I think Leslie might have some thoughts on this one as well.
Sure. Yeah, the way I've designed the patient or consumer portal is to be interactive, so not just providing information, but also because of the database engine that runs behind it and is integrated with it, to be able to capture real-time data and feedback from the consumer that providers have access to. And it also has the capability to, for the providers to post forms and surveys that they need information on to manage the practice. And that piece of that interactivity coupled with the messaging, and I appreciate all the work NEHIC is doing to formulate this common messaging. The way the Health Cause platform is set up in 3 key themes: proactively manage your health, work closely with your healthcare provider, and be a true consumer when using healthcare resources. So the goal is to push that consumer and the provider to work together in a collaborative environment, and the portal is set up to do that.
This is Leslie, and thanks, Rose. I agree that the portal is a key component, but I think that Rose really hit on it as a communication vehicle as a primary function, because no single person in healthcare is right all by themselves, right? There's always a team involved. So the notion of communication and interoperability is one that has to be pervasive across health information technology. And the patient portal might be part of that. The patient communication out of that portal into other direct type of compatible systems. The patient's information integrated back into the health record that is actionable by the provider. For example, today patient preferences are not really considered in an ordering process. If my religious preferences stated that I couldn't use certain blood byproducts, that should be part of the record, and I would be the one to provide that information. So we see a day forward of very highly interoperable communication, and I think that Rose hit it on the spot. It can't be data for its own sake. It needs to be actionable, interoperable, and meaningful.
Great. We had a follow-up question to an earlier comment about patient consent, and again, I'll ask both of you to weigh in. So when discussing consent, is consent needed when a patient requests information about their own health versus patient information exchange among providers?
Well, I would say consumers you don't need consent for consumers to get information about themselves. The consent comes into play when that information is transmitted to another party.
Leslie, you want to add anything?
Nope, that's exactly right.
Right, okay. Now, we had a question earlier, and I wanted to come back to it, and I don't know if you guys have opinions on this, but I suspect you have some thoughts. So the question is, what concepts or strategies have been learned or utilized from the health record bank model with regard to consumer engagement and adoption? Rose, you want to start?
The health record bank model. I'm not familiar with the model or the acronym that they're using.
I think the health record bank concept is almost like, it's sort of the opposite of a PHR, like basically people, like they authorize data sources for them to put their own data into like a bank account, if you will, and then they can decide who can access it. I mean, that's my understanding of the model.
I thought it was a specific acronym for like a demonstration project. No, I think that's exactly the right approach, and I've seen one large health plan do this pretty well, where the patient is able to click on the various providers that should have access to their data, as well as family members and caregivers and other constituents that they might be interacting with. Organizations. So I think that is the right approach, and giving the patients or the consumers control over how they direct that, as Leslie gave the example earlier in the presentation about, the fellow from Cerner saying, patient directed, and then it's our responsibility or provider's responsibility to, make sure those protections are in place.
And this is Leslie. I would add to that we're still, as an industry, defining the trust. We're still defining trusted sources of information and a chain of trust. So access and interoperability is absolutely fundamental. It's the plumbing that we need to put in place. But as our information use gets more interoperable, in order for actions not to be taken or actions to be taken as a result of that information, there has to be a sense of trust. And so I think that's an emerging area of making sure that as information moves, it is trusted information. I do know that as a patient, I can't possibly predetermine all the needs that my provider might have as I came in from an accident on the freeway. And I want to make sure that there are no barriers to having information to care for me. I also want to make sure that when a provider sends information like a radiology report or an x-ray to another provider, that action itself can avoid unnecessary testing. Well, it can when it's trusted. So I think that the banking concept and idea is a good one, and especially addresses interoperability and exchange and consent. But we still have a long way to go with regard to chain of trust and trusted actionable items and information.
While we're on this topic, maybe one more comment on this patient flow of information and the communication with the providers, please, 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 in all your disclaimers and interaction with the consumers, make sure that it's clear that these vehicles, these portals for communication, are not vehicles for real-time raising of concerns with a provider that's going to address their issue. That I'll put in my different messaging, if you have a real-time health need, please contact your provider, directly or immediately. They cannot be under the assumption that any data they put in or any assessment tool that they complete, that some provider is looking at that real time and reaching out to them.
So Rose and Leslie, thank you so much. I think you guys led great conversation, and I think we had a really good interactive session today, so that was fantastic. Before we bring this to a close, I do want to give Jenna one last chance to offer up to everyone how you can provide input into the both the messaging that we're working on as well as the framework for patient engagement. So Jenna, do you want to just run that by our group one more time?
Sure. So in order to help us out with messaging or with providing feedback in the framework, all you have to do is visit the link here on the slide, nationalehealth.org/consumers, and that will give you links to join the consortium, to get more information, and to participate in the messaging and the framework feedback process. If you'd like to participate in either of those things as well, please do email consumers@nationalehealth.org. And the instructions that I gave earlier for joining the NEHIC online community will be in the recording of this webinar. So we have been recording this meeting, and that will be available for download at the link on this slide as well. So if you go to that page, you can download the presentation slides from today, and in a couple of days, we will have the recording of this meeting available for you to look at. So again, if you have feedback, questions, email us. I will be following up next week, sending around the framework for those of you who would like to comment on it via track changes in Microsoft Word. So we will have opportunities all over the place for you to give feedback and provide the comments, because we really do need the help of the members and the feedback and expertise of the members of this consortium to move everything forward. So with that, I will turn it back over to Kate.
So, and I will just thank everyone, and I'll say a wonderful, great meeting on a Friday afternoon, especially on a holiday weekend. So whether you're celebrating Passover or Easter, we wish you a happy holiday weekend, and we appreciate your ongoing engagement and look forward to hearing from you in response to everything we talked about today. So enjoy the weekend, and take care, everyone. We'll see you soon.